welcome back to my channel. This will be my last video on enzymes, and here we'll speak about how to determine the enzyme activity in laboratories and the clinical importance of some enzymes. So starting with the determination of the enzyme activity, how we can find out the levels in the blood or in the urine, for example. So the blood has plasma, which is the non-cellular part of the blood, and it contains a few coagulants, and anticoagulants can disrupt the enzymes in the plasma. So this is why in laboratory assays of enzyme activity, most often we do not use the plasma, but instead we use the serum, which is obtained by centrifugation of the whole blood in the laboratory. And once you get the serum, you can then carry on to do electrophoresis, which can reveal the presence of certain proteins and enzymes. Okay, now moving on to the clinical importance of enzymes. The level of specific enzyme activity in the plasma frequently correlates with the extent of tissue damage. So therefore, plasma enzymes can act as diagnostic tools. So I'm going to name some diseases and the enzymes that can be specific to those diseases. Starting with hepatitis, which is a disease of the liver. The enzyme alanine aminotransferase, often written as ALT, is abundant in the liver, and it is quite specific to the liver. So high levels show possible damage to the liver. Moving on to myocardial infarction, which is heart attack. So plasma levels of the enzyme creatine kinase are commonly determined in the diagnosis of myocardial infarction. Now, in my previous video, I mentioned that creatine kinase has 3 different isozymes, and the main isoenzyme responsible for the myocardial tissue is the MB isoenzyme. So it appears 4 to 8 hours after the onset of the chest pain, reaches a peak at 24 hours, and then returns to the normal value or baseline after 48 to 72 hours. Now, there are 2 other proteins, so troponin T and I. They're not enzymes, but they're regulatory proteins, which are also involved in the myocardial diagnosis. So they're released after the cardiac damage only, and troponin I appears to be more sensitive, and it appears within 4 to 6 hours, peaks in 8 to 28 hours, and then remains elevated for 3 to 10 days. So it is quite good for clinical diagnoses. The next disease is acute pancreatitis and parotitis, which is another name for mumps. So the enzyme responsible is alpha amylase, which breaks down starch to maltose, which are carbohydrates. So this enzyme is present in the salivary gland, which is why it is specific for parotitis, in the pancreas, which is why it is specific for pancreatitis, and in the placenta. In mumps, which is parotitis, it exceeds 1,000 international units per liter when the normal value is only 50 to 120 international units per liter. So this tells us how specific it is for the disease and how helpful it is for diagnosis. Now there are some other enzymes which are not very specific. So for example, aspartate aminotransferase, AST, is found in a diversity of tissues like liver, heart, muscle, kidney, and also the brain. So it is sensitive, but it is not specific to a certain disease, because if the levels are high, it can either be the liver damage or muscle damage or even brain damage. So it is not specific. Then we have lactate dehydrogenase, commonly known as LDH, and it is for the brain, the heart, and the muscle. There are isoenzymes of this too. It can be used, it is commonly used for heart disease. And recently, the enzyme glutamate oxaloacetate transaminase, SGOT, shows good specificity for myocardial infarction. So it is most commonly used right now. And this is it for this video. Hope you enjoyed it. See you in my next one. Bye.